Okay, landmarking, subcutaneous. Subcutaneous landmarks are the abdomen, in the lower belly, in the thigh, upper arm, in the back of the upper arm, and your lower back. You should be able to grab 1 to 2 inches of skin. If you can only grab 1 inch, you will stick the needle in at a 45-degree angle. If you can get 2 inches, then you would stick it in straight up and down at a 90-degree angle. In intermuscular injections, IM, is the deltoid, just below the bone, the gluteal. You'll find the top of the femur. You put the palm of your hand on the top of the femur, and you turn the hand towards the back, like towards the butt. You spread your fingers, and you will stick the needle right in between the pointer and the middle finger, right about here. And then the vastus lateralis is the outer middle third of the thigh. Digoxin. So assessments that you would give before giving this drug or any other drug is vital signs. Not if they have nausea and vomiting, inability to swallow, and if they're aspirating, and you should also monitor BP. When would you give this drug? 1 hour before or 2 hours after a meal. When would you hold it? If their pulse rate is less than 60 in an adult, 70 in a child, and 90 in an infant. How many times do you check the ladle before giving a drug? 3 times. Your 10 rights are: right drug, client, dose, time, reason, right history and assessment, right approach and right to refuse, right drug approach and right to refuse, right drug-to-drug interaction and right evaluation, right education and information. So you have to give insulin. The doctor's orders say 20 units of Humulin R and 10 units of Humulin N subcutaneously. First you would mix, so you would take your 2 drugs, and you would inject clear and then cloudy, which clear is Humulin R and cloudy is Humulin N. So before you administer any insulin, you have to check blood glucose levels. The normal parameters for BBIT, the normal BBIT parameters for blood glucose level is 4 to 8 millimoles for fasting and 5 to 10 millimoles per liter for normal. So I'm going to draw up some insulin now. You get your insulin needle. It's got the orange tip. First, obviously, you'd have gloves on and everything. Your hands would be washed. You take this off. So you take off your little cap off this one. I already took it off this one. I only have this one on. So you take this one off. And then you always, no alcohol swabs, but you always use an alcohol swab and you clean off the tops. Okay, so after you clean off your tops, we're going to do our injection. So take the tip off of this, set it down there. Grab your Humulin R first because you do clear, then cloudy. So you take this, and so you double check. So I need 20 units of Humulin R. Pull out to 20. Stick her in. Inject the air. Flip it upside down. Pull out to 20, back, take her out, and then stick it into Humulin N, flip her upside down, and pull out to 30. Okay, there we go. So now we have our insulin. Most likely when we do insulin in the hospital, we will be sticking it in the back of the arm, back here. So you would grab the skin, make sure you can grab 1 to 2 inches. On frail ladies, you may only be able to get 1 inch, so you would have to stick it at a 45-degree angle. But let's say we're doing it to a person like me who's got a good amount of skin back there. So we're going to be doing it into an orange. So we grab the skin, we grab it, we make sure, since we're doing it up here, just back here, we just make sure that we got the right angle. So I'm just going to go in at a 45-degree angle, and we're just going to pretend like this is the back of my arm. So you just stick it in straight, up and down, go in nice and slow at a good rate, hold it for a second, and take it right back out. Sometimes they might bleed a little, but most likely they're just going to be fine after. So that's how we give insulin. After we're done giving insulin, we have to document that we gave the insulin. So then once you're done, you obviously have to hear the click, so your safety is on. And then put your needle into your sharps bin. So after that, we have to document. Where do we document for once we've given insulin? Into the blood glucose and subcutaneous insulin record, and also in the patient's chart. Say we have a patient who is in a lot of pain and is requesting something for pain. So what do? We ask, where is your pain? And can you rate it on a scale of 1 to 10? Oh, my thigh really hurts because they broke it or something, and it's like an 8. Oh my goodness, you're in a lot of pain. So we check the doctor's orders. Oh, the doctor has an order for morphine, 5 milligrams intramuscular, Q4 hours, PRN, so as needed. What needs to be done? So morphine comes in ampules, and typically in a hospital setting, you only have 5s or 10s, but in our lab kits, I have 2s and 1s. So you have to break your ampule. Be mindful not to cut yourself. In a hospital setting, they might have a special thing that goes on here that breaks it for you, or just use a paper towel or something. I will be using a paper towel to make sure that I don't cut myself. You'd obviously be wearing gloves as well. Hopefully you'd be wearing gloves. You also have to make sure that you have ready with you the right needle. So since we're going to be, it's 5 milligrams, so you're going to be having I had to double check to make sure that I had the right needle. So it turns out I only have 3 milliliters in needles in my lab kit. So we're just gonna work with what we have. So to remember, when you have ampules, you have to be mindful not to cut yourself, and you have to use a filtered needle end when you are pulling out the medication, because the filter on the end makes sure that if any glass got inside the ampule, the filter will just make sure no glass gets inside your needle in the end, and you don't end up injecting glass into your patient. So once you have drawn up your medication, you would take this needle off. Make sure you put the red cap back on it before you take it off, or before you take the needle off, and then you would put your regular needle back on. For intramuscular needles, typically you would also have a bigger needle, but I don't have anything bigger than this, so this is what we're working with. Safety precautions that you need to make sure when you are dealing with morphine is you need to check their respirations before and after giving this medication, because morphine can cause respiratory depression. So if they already have low respirations before, you should probably call up the doctor to make sure that it is still safe to give them this medication. And then during, you also have to make sure that their respirations stay good, or else they could stop breathing. You also need to make sure that they don't have any allergies towards morphine. Sometimes doctors don't realize when they're prescribing something that someone is allergic to it, so you always should double check. For documentation, you need to always, on the narc sign out, because morphine is a narcotic, you have to sign it out. After you've given it, you do your documentation in the MAR, on the PRN page, and in the patient's chart. Agent policy is you need to make sure that in wherever you are working, if they aspirate or not. And you always go with IM injections, you always go in at 90-degree angle. Yeah, so we're just gonna draw up our morphine now and give it to our patient orange. So I'm gonna break them. So this is a 2. Another 1. So they are vacuum sealed, ampules are. So you don't typically have to worry about it until after you've drawn them up. And this is the 1. So break them all. You also have to make sure, typically in a hospital setting, you only have 2s and 10s in a hospital setting. That's right. So when you would either have to take out a 10, and most likely you would, because we are only allowed, this order says for 5 milligrams. So when you take out the 10 and you only draw up the 5 that you need. And with narcotics, you have to make sure that you get someone else to double check, like say, here's the rest of this drug, that you sign off and they sign off saying that they saw that you threw out the rest of that drug in the garbage. So I got my ampules open. I'm going to take out my needle now. So here's my syringe. Here is my needle with the filter on it. Take this dude out. Screw him on, make sure he's on there nice and tight. Take this dude off. Got all of that one, I think. Yeah, I don't think I'm going to be able to fit all of these in this one, but in an actual hospital setting, you would have bigger syringes, and just working with what I got. So we're going to pretend like there's 5 mils in here. And then just going to do this dude. Get those bubbles out of there. Okay. And then you can't really see this, but you then take your needle, which does not have the red cap on it, and to put the red cap back on so you can take that needle off and put the needle that you will be doing your injection in, you just slide it off the table. and slide it on. The red thing, so pretend this is on the table, the red thing's on the table, and then you take your needle and you just slide it on in. So then we've got our morphine in here. So we go up to the patient's room, make sure we got the right patient and everything. You do all your checks, and then so before you obviously leave, before you leave the med room, I guess it's called, that would go into your sharps bin. You put a new guy on, the guy that you do your injection with. Flip that up. Okay, you go up to your room. Good morning, Mr. Orange. You have ordered your morphine, and I have it here. You don't have any allergies or anything like that? Nope. But your respiration's good, your blood pressure good, done your vital signs. You're great. Are you ready for this morphine? Yeah, I'm in a lot of pain. Okay, cool. So we'll be giving it into your glute. So you feel for the top of the femur. I'm going to back up to see if you can. Nope, that makes it worse. So here, that makes it better. So you feel for the top of the femur. My femur is right here. I would put my hand here, and then I would twist it backwards. If I could twist my hand all the way backwards, you would see, but it'd be about right in there where you would give it. So I've landmarked where I'm going to give the injection. Say, this might pinch a little, but you'll feel a lot better. So you take your cap off, you landmark, you find your spot, you squeeze a little bit, and you stick it in at a 90-degree angle. And so you just bloop like a dart, nice and fast, don't go slow. And then you give it in nice and slow. Hold it for a second and then take it out. Then you would take your gauze, we're going to pretend this is gauze, and then you'd put a little pressure there. We don't massage though, put a little pressure, and that's great. And then 5 to 10 minutes, you come back and check, make sure you put the safety cap on it, dispose of it into your sharps bin. Yep. Okay, I think that's it.